I am Gabriel Gonzales-Portillo. I'm a neurosurgeon at St. Joseph Hospital in Tampa, Florida. Lumbar stenosis is a condition where there's overgrowth of the bone, the ligaments, and all that put pressure on the lumbar nerves. The most common cause of lumbar stenosis is due to degenerative condition. There's some other patients who had a congenital narrow spinal canal, which means they are born with narrow spinal canal. Lumbar stenosis can present different ways. You can have back pain, and you can have shooting pain down the lower extremities. It's very frequent for a patient to have what's called neurogenic claudications, which means that if they are standing or sitting, there's no pain down the legs. But the minute they get up and start walking, they start having excruciating pain down the legs, so they need to lean forward. If you see in the grocery store or in some elderly people leaning forward in the cars, that means that you can make the diagnosis of lumbar stenosis. They need to lean forward to open the spinal canal to create more space for the nerves to alleviate their pain. A risk factor for lumbar stenosis could be hereditary. If your parents had a bad spine, most likely you have a bad spine. But really just degeneration of your spine. So certainly you involve multiple accidents that can accelerate the degeneration, but that's a normal process of aging of the spine. The difference in some patients is more pronounced than others, and some patients are symptomatic versus others that may not be having any pain. The diagnosis of lumbar spine is clinical, just talking to your patient, and you make the diagnosis. You ask it, hey, when you go to the grocery store, do you lean forward? Yes. You made the diagnosis. And you will confirm the diagnosis with x-rays and an MRI of the lumbar spine. Treatment is conservative first. This stenosis doesn't happen overnight. It's happening over years. So if the pain gets worse, we recommend some anti-inflammatory medications first, refer to physical therapy. Sometimes we refer to get some cortisone injections. And if all of the above fails and patient still symptomatic, that's when we recommend surgical treatment. But nowadays, since we do a minimal invasive, now we can take care of those patients through small incision. We can put some tubular dilators, and then we can decompress the spinal canal multiple levels, and those patients can be up and walking, going home the following day.